In other news, pill mills, or pain clinics that take advantage of the illegal distribution of prescription painkillers, is in the crosshairs of Florida's Attorney General, Pam Bondi. Bondi states that Florida has become the epicenter of prescription drug abuse, and that's why she's asking Florida lawmakers to pass tough legislation which includes steep fines, automatic suspensions, and the escalation of reoccurring offenders to felony status. We talked with Dr. Cesar Uribe at Central Florida Pain Management about his take on what pill mills have done to legitimate practices and the steps they take to ensure the highest level of accountability in patient care.
Life is what it is. 2–3% of the people are dealers, and 2–3% of the people are drug addicts. And we are now obligated, because of unscrupulous physicians or providers in many different areas of Florida and other parts of the country, that open these clinics and call themselves pain specialists. And what they were actually doing is prescribing controlled substances for whatever purpose the client was buying them or getting prescriptions for, and making money out of that. That's what a pill mill is to me, illegitimately prescribing opioids or controlled substances to people that are not going to use it for the legitimate medical purpose. Because of all that activity, pain centers of board-certified people like me and Ryan and my partners are having to go through the process of being audited, controlled, and that's okay. We were complying with it from the beginning, so we have nothing to hide or fear. But it's the pill mills have destroyed pain management.
We have a lot of checks and balances at Central Florida Pain Management to make sure that patients are compliant with medications. Some of the things that we do to safeguard patients who are on narcotics or opioids, as we call them. We do random urine screenings here. We're looking for any type of, we're looking, number one, to make sure that the medications that we are prescribing to the patient are in fact in their urine, and we're also looking for other types of controlled substances or illegal substances in the urine to make sure that those aren't present. Other things we do is we ask the patients to bring their medications into every visit. We count their medication to make sure that the count is where it should be. You know, for example, if a patient was here last week and we gave them a prescription for 90 pills of, say, OxyContin, you obviously would not want them to come back a week later and be out of OxyContin. That would be a big red flag to you. So it requires a lot of vigilance, a lot of monitoring on our part.
The main one is the fact that they are all evaluated and document medical necessity. I mean, no longer can a patient come to any pain center that is worth a dime and tell them, I'm in pain, oh, here's your Percocets. No. Now we have to document medical necessity. We've been doing that for 10 years. I mean, the medical literature in pain management has been there.
There's an estimated 930 registered pain clinics across the state of Florida, yet Florida's Department of Law Enforcement states that there's about 1,100 pill mills across the state. To learn more about Dr. Uribe's credentials and for more information about the numerous forms of monitored pain management available at Central Florida Pain Management, visit their specialist directory listing online at yourhometownhealth.com.